take it away. So, so we'll put up the agenda. It's pretty straightforward. Well, actually, it's changed a little bit. Amanda, do I have to give you co-hosting there? Oh, there you go. Yeah. So let me briefly just kind of talk this through. We have a little bit of an adaptation here that we're gonna modify a bit. And we just had one more person join from 202. So that's a DC number. Who's from 202? Welcome.
Hello, this may be Whitney Weber with ONC.
Oh, okay. I see you a few times. Welcome.
Yes, I have to dial in. Yep.
All of yourselves are welcome. Thanks. So we're going to, because some people are only able to join for a little while because they got to get back to their events. We're going to just do some intros quickly and introduce some of the new people on the call. Excited about some folks who are joining us to participate both in Unify, but also in the consent scan and the work that we're doing on that. So we'll do that. And then we actually have two pieces of sort of, so to speak, business. One is I want to share with you, we had a call with the Office National Coordinator yesterday and Whitney was on there. So I wanted to share some of the slides with folks just to bring everybody up to speed on what the conversation was and kind of where we're headed. It was a great call, and there's some interesting stuff that relates obviously to the consent work. And then we'll pivot and Adam will lead us in a conversation on where we're at on the scan. And there's several people who will be doing some quick report outs as we start to put that documentation together. That'll be helpful to kind of hear different voices out there because we're sort of accelerating the efforts on that. And I think those are the main things that we've got today. Coming up in a couple of weeks, we've invited some other presenters. So I spoke with Marianne Yeager from Sequoia, and she's going to talk, I think on one of the next couple of weeks, we're trying to coordinate between a couple of different presenters on TEFCA and the common agreement and kind of some of the requirements and standards. And then we have some folks from PP2PI talking, and also Ken Salyer and folks talking about consent to share. So those will be sequenced over the next couple of weeks to try to bring in some more content that we'll want to integrate into our different work streams. So stay tuned for that. And Amanda, maybe what we'll do is we'll, as best we can in the next week, sort of list out those dates and the topics of conversation, because some people maybe we need to get those in front of folks there. So with that, let me jump into introductions for some of the new people. As I said yesterday, we had a great ONC. I'll get to that in a minute. Why don't I start on the top of my screen? Alex Horowitz, greetings, and got introduced to Alex through relationship with the California Alliance, which is the child-serving nonprofit association in California, who was doing a lot of ACEs related work. And Alex got pointed in our direction and is doing a bunch of really interesting work. So Alex, welcome. Take a few minutes and just tell us where you hail from.
Sure. Thanks, Daniel. Hi, everybody. Thanks for allowing me into your group. This is really exciting. I just found out about Project Unify through some work in California that we were doing around technical assistance for the various ACEs Aware grantees throughout the state. I work for a firm called Intrepid Ascent. I'm our principal technology strategist. Karen Ostrowski is also on the call today, who's my counterpart on the community and data governance side. And as that suggests, we're a small firm. We do a lot of work with communities that are trying to do cross-sector data sharing. We do, sort of technical advising and also community data governance advising, privacy and security, that sort of thing, for essentially building CIEs. I come from the HIE world. I've been doing this work for about 7 years, and over time, as you can all imagine, it's sort of gone from HIE merging into sort of more broad cross-sector data sharing and all that comes along with that. So really excited about have read about the work that you've been doing and these discussions. It's really sort of smack dab in the middle of the work that we do with clients and communities in California and New York today. And happy to talk more about my experience, but that's kind of it in a nutshell. Yeah, thanks Daniel again for including me.
Yeah, that's great. I was excited to see some of the work that you shared with us on what you've been doing there and sharing around. So we'll, if I'm not overstating it, I think you're interested in some of the work group activities. And so as you hear today, and as we go forward, we'll connect you in with folks. Just as an aside, Kathy Miller runs the New York Rio in the Bronx. So with connected to my hospital. So you may know each other from the HIE world.
Yes, from a few years ago. It's been a while, Kathy. But,
it has, Alex.
Yeah.
Nice to see you again.
Nice to see you, and I might see you at Chic, I think, too. You're presenting there next week. Yes, okay,
Yep.
well, I'll see you there.
I'm getting in on Sunday. Bye.
Hey, Karen, you want to just say a few words, introduce yourself as well?
Yes, absolutely. Thanks for inviting me to participate. So I'll kind of spare the kind of background on the firm. As Alex said, I am also a principal strategist, but in the areas of data governance. So Alex and I kind of tag team. He's the technical side and I'm the policy side. I've been working in this space for about 10 years. I started in HIE and policy during the high tech grant years. And I help support a lot of early policy development, particularly in the consent space. So that's an area of kind of interest for me, helping shape the consent approach for HIEs in California, and have continued that over the years. And as Alex said, that has now kind of evolved into more cross-sector data sharing and data governance, privacy, understanding the laws and regulations and how to apply them in those context situations, and have helped build consent forms and data sharing agreements and things like that for those kinds of organizations and communities that are trying to share information more broadly.
Great. You are where you belong.
Wonderful, that's exciting. Finally found it.
So just to point out the connection, so Chris Albatrani, who's on the call but you can't see her, and Jennifer Bernstein are both part of the sort of the legal privacy group, and are welcome you with open arms.
Wonderful, so, thank you so much. Appreciate it.
And I'm assuming the PowerPoint, the slide deck that you shared was great. So I'm looking forward to sharing that. That was really clear articulation of a lot of the stuff we're talking about, which is wonderful. And I guess if we figured it out in California, everybody else is easier. So, right?
Well, sometimes yes, sometimes no. So, but yes, glad to be here. Thank you.
Yeah, welcome. So, Pooja, welcome. I don't think you joined us here or introduced yourself in the past.
Yeah, nice to meet everyone. Pooja Babur with Point of Care Partners, and we are a health IT strategy consulting company. Really started out on the more on the pharmacy and e-prescribing side, but as we've grown over the years, have expanded a lot into other areas, including HIEs. We do a lot around interoperability, and I was kind of brought into this group based off some of the work we did recently with MyHIN around advanced care directives and e-consent, and some research we had done there. So I'm primarily going to be involved with the e-consent scan that is happening, but I'm excited to be learning a little bit more about what you guys are doing here. And I'm actually in Scottsdale and will also be going to the Chic conference. So look forward to meeting a couple of you guys in person next week if you're going to be out here. So.
Great, you guys can have a virtual, not even a virtual toast, an actual toast there. It's great.
Yeah, I skipped hymns, but I'm doing Chic, and then I hear all these hymns people are headed here, so it'll be interesting.
Fill that conference void.
Yeah.
I'll let the first wave of sacrificial lambs head out.
Yeah, exactly.
Hopefully it won't be the Delta Force, as they say. So, bad joke. I think Mary Sarah Jones, welcome.
Yeah.
Howdy.
Hi, thank you, Daniel.
I live in Arizona in the Phoenix area, so I will also be at Chic next week. So it'll be good to connect with some of you. I am with AWS, and before joining AWS, I was with IBM, where I was supporting several cross-program data sharing projects, including San Diego, Los Angeles County, and Sonoma County, and some work with the state of New York. And before that, I was working in healthcare. So I started in the healthcare mindset and then moved more into the human services realm. I really focus on both state and local government right now, doing a lot with Medicaid, especially looking at the waivers, the 1115 waivers to support housing for individuals with serious mental illness. So trying to help organizations figure out how to share data, how to get over the business challenges, which is seeming to be even more difficult than the technical challenges. And part of the risk management, in my mind, is fine-grained management of data access and consent, and having those two tightly coupled. So I'm very excited to work with you on that endeavor, specifically where we're not sharing at a record level, but we're able to carve the data up appropriately for the different stakeholders.
Thanks. I had the great pleasure of meeting Mary Sarah actually on a while ago in and around San Diego, and had a wonderful time working together. So I'm really glad that you're here and that you're rolling up your proverbial sleeves and will be contributing to this. It's growing by the day. I'm more and more excited every day in terms of the bandwidth and just the intellectual capital being brought to this endeavor, which is just great. So welcome. And feel free, like everybody, feel free. This is, raise questions, ideas. These Wednesday meetings are really intended to kind of bring people up to speed on what's happening. They're work groups. We're trying not to do like in-depth work group work during these calls because there's so much just to convey from week to week or information to share. So Adam and Amanda are working assiduously to try to sort of facilitate your participation in content development, as I might say, over the next couple of weeks. So be prepared. If we've got your email, we know where to find you, so to speak. So just a quick note on the agenda here. Amanda does a great job of doing a weekly recap of the notes. It's on the Hub site. You'll see it. It's a link to the weekly Unify notes. If you want to dig into stuff and see who has been participating, go there. If you go to the Hub site, you may notice we haven't really focused on that. We've really slimmed that down. We are focused really on Unify and consent, mostly on there at this point in time. So we've taken off a lot of the other stuff. And ideally, if we got a minute later, we would just show it to you. We're just kind of focusing people on that so that we can really sort of.
You're talking about the working doc?
No, I'm just talking about the Hub altogether.
Altogether, okay,
easier
got
to
it.
navigate. It's a clear focus of what we're focused on. We had a lot of other groups. We had SDOH groups and opioid groups and a lot of other things that are still there, but they're just not front and center. So it's easier to get into, easier to find stuff, and hopefully easier to participate along with our SharePoint materials.
Right. A lot of you, and it's actually worth saying because we have so many new people on the line, that the Hub has been the central focus of a lot of our work over the last few years. That is the National Interoperability Collaborative Collaboration Hub. Those of you who don't know about it, I think it'd be great if you could show it later. And I'll second what Daniel said, which is that it was a bit, shall we say, complicated to navigate. And I think we've cleaned it up pretty well. It should be more hospitable.
So might as well strike while the iron's hot, so to speak. I'm just going to show 1 second just for some of the new people get a visual of it. So when you come into it, you see three things with basically Project Unify and then the consent work. And then the working groups here, we also have the opioid prevention work that we had done, which is unfortunately still top of mind for folks. So we're trying to reactivate that. But you go into each of those groups and there's like under Unify, just, and I'll move on here. You'll get to meetings, a lot of sub menus in terms of the different work groups of security, user stories, fire, and the members. So it's pretty straightforward along with some of the videos and demos. So just if you have a few minutes just to orient yourself to that, it's really an easy way to sort of share what we're doing, especially on the consent piece. And this stuff is always needing to be updated. So as we come into it, feel free to add comments as well. So here's just a one, like literally a one page on, why we're doing consent, what the process is we're following, and a little bit on the scan and some other materials here. So if you need a snapshot or you need to share it with somebody, there's written material and there's 1 and 2 pagers and longer docs, but this is a good place to put people, to point people to. So with that, let me pause for a second and just see if there's any comments before I go into the ONC doc for a moment here. Any thoughts, questions, responses? Quiet group today. Okay, so let me just dive into this. I'm not going to go through all of these, obviously. A lot of these we've seen before. I just want to sort of share a couple of the main points here. And the point of the presentation, ONC and Whitney has been on this call, been on other calls over the last year or so, other ONC folks. We've been sort of synchronizing with them. And a number of the folks on this call are involved with some of the ONC initiatives. Year before last, we featured a lot of the accelerator sites, and a lot of the efforts between Gravity and Da Vinci and FAST and others, and the fire groups. So it's been an ongoing relationship with them. And so we had a chance yesterday to spend a little time and kind of just focus in on the consent piece. So long title, but we're really talking about, this project where we are currently focusing our efforts. We talked about, sort of the business case for consent. We talked about the context under which it's operating, which is the NIC, which is this group here, and where it came from over the last year with the national agenda that identified consent as one of the potential structural system level kind of changes. We talked about the consent utility, and I'll share a couple of pages on that. And then the immediate implementation opportunities, mostly through the Inc. sites, the New Jersey, New York, and Connecticut Inc. sites, but also others. We've been in conversation in other states as well as California and Arizona, to name a few. I spoke, Brian gave an overview, and then Dr. Coy talked a little bit about the Inc. sites, so it wasn't only me hogging the microphone. So we wanted to, I'll just spend a couple minutes here and then we'll move forward. And again, interrupt, put a question or comments into the chat if you want. We wanted to define sort of we call it a business case, but it's really kind of the imperative. So you can read that. The bottom line is, if there is a electronic tool out there that can do HIPAA, FERPA, 42 CFR, and the other consents, we haven't found it. So we don't think it exists anywhere. In fact, I'm pretty guaranteed that it doesn't exist anywhere. But people have different pieces of it, right? There's different pieces on the advanced directives that Point of Care Partners was working on, some e-consent stuff, consent to share. Some of the, CRISP work was going on in that area, and New York is doing it, and Mayan is doing different pieces of it. So, without consent, and attorneys on the call, correct me if I'm wrong here, but with consent, we solve a lot of the problems, reduce a lot of the friction in terms of getting to sharing information. You need all the protections and all the information, the purpose and all those kinds of things, of course. But if you can actually easily make the transaction of providing consent to people in a form that they can use and understand, that has a potentially significant impact. And if it can be done in a replicable, customizable way by jurisdiction, then we avoid the recreation, let 1,000 flowers bloom, and everybody does it a different way. Hopefully with the standards that are being promulgated, we can do that. So we think we can make significant progress with the interoperability work, and especially in concert with what's going on at ONC. So obviously the goal is to make appropriate information accessible electronically when and where it's needed by creating a common interface to share PHI, PII. the problem, that's the goal. The couple more pages I want to share with you. So we laid out their objectives here, really 4 objectives. One is we definitely want to build on the progress innovation from ONC and industry. So, you know, let's just, this is the point of the scan we're doing, which is to take a point in time snapshot of where we're at. So your contributions to that will be are obviously critically important. Want to increase data liquidity to improve care coordination. This is, you know, reducing friction. And it's important to, you know, there's so much healthcare stuff going on always, and everything tends to get sucked into an EHR conversation. That we really want to represent the fact that a lot of the people who have been doing the work at NIC and are coming from the social services, the education, the justice side of things, public health side of things. And now is the time to make sure that we're making sure that whatever's getting built on the healthcare side can actually interface as seamlessly as possible. So we can really try to make some progress on social factors. We want to obviously implement this thing. I think that's one of the really important differentiators here. It's not just a set of recommendations. While it is that, and it is artifacts and implementation guides and stuff like that, but it's let's go do it in some places, and let's do it in 21 and 22, not 5 years from now. This is going to take some funding though, right, and supports to make that happen. And that's what, you know, part of our appeal to ONC was to say, how do you point us in the right direction? How do we partner? How do we sustain this work? There's a lot of people on this call and elsewhere who dedicated a lot of time. I think now with everything going on is the time to ramp up the efforts and see if we can make this happen sooner than later. So again, as part of the presentation, we showed our logo page. Apologies if folks are not on here that feel like they should be on here. We wanted to represent people who are kind of rolling up their sleeves. By all means, send me an email. We'll put you on here. You're not on here now. But it's impressive. You know, people are coming to the table with a lot of different perspectives and knowledge and expertise. And that's what we really want to share. So we went through our usual background on why the NIC, cross-sector stuff, support from Kresge, the national agenda where we brought people together over the COVID year and identified consent as a really critically important piece. And then the other piece here, which we talked about a little bit, is the interoperability training program that we put together again with Kresge Foundation and our WJF support, which is really it's the organizational change effort. How do you create a common language? How do you help spread that across agencies and domains so that people have a common understanding of not only strengths and development areas, but a common language to do that. And we'll talk more about that, but I think the sustainability of this work means people have to be able to speak a common language. And that's one of the things we're trying to do. Brian talked about the vision. We talked about, Dr. McCoy talked about Inc. as a need to connect all the dots between these programs over the next couple of years. So we got runway, we've got funded sites that are doing the work and need to get the consent work done. We have a number of work groups. I'll pause just for a second on this that are part of Unify, right? Unify is the larger initiative that's saying, how do you do interoperability? The consent work is sort of embedded in that as a very specific, tangible implementation piece. So these work groups are happening. Some are more happening than others. And we hope to sort of ramp them up, continue to ramp them up and deliver content materials. And here we shared, again, the teams, the 3 work teams that are working on the consent. I think this is, as of yesterday, at least, this represents, I believe, most of the people. Again, if you're not on here and you're doing work, I apologize. But again, it's a very, you know, people are rolling up their sleeves, and it's an impressive group of folks to be able to work with. And we hope to be able to orchestrate it in a way that delivers content and value. So there's just a few more slides on the kind of what's next here. And so as what we shared was we're doing a scan. That's what we're in the middle of. We're building on prior efforts. You can see from San Diego, from SAMHSA, from Rio, Chris, those guys. We're developing the requirements and blueprints for the implementation and that would obviously be useful elsewhere. and we're looking for additional resources to support the continuing development, publishing roadmaps and stuff. And in fact, that was, well, I'll talk about that more in a bit in terms of what came out of the meeting yesterday. This is just sort of an expansion on the objectives I showed earlier. Want to build on promising practices. Second point here, the legal hurdles for data sharing, critical point, how to do that, work with counsel and privacy officers within the jurisdictions. See if there's anything I haven't spoken about. Obviously leveraging open standards, open source, standards-based kind of API tools, and again, incorporate work from ONC, including the ones that are listed here and others that we're discovering along the way. Oh, and we did speak with, oh gosh, I just spaced out her name, from Hart and Uma. I'm sorry, I forgot. Brian, do you remember her name? Anyway, they're going to be presenting some of the work that they've been doing as well as part of the ONC.
Right.
Right. And then, I think the imperative here is to do something now, right? We're at a historic moment in time, and if there's ever a moment ripe for change, we're here. And so we need to think big about that. Again, another visual of who the ecosystem is that we're trying to integrate, or at least present and involve, and recognize who's doing work in a related field here. There may undoubtedly be others that are involved that we want to make sure we're paying attention to. Again, this is kind of the one of the points that we left the meeting with, which was our recommendations, was how to really take advantage of the momentum that's going on, and to work with ONC to help us understand what we don't know, right? We have to watch out for what we don't know, and hopefully everyone on this call and ONC, because they have a lot of visibility in other places, we want to bring that visibility to this work. And so that is the conversation with ONC, where I think they've got a better, deeper understanding of what we're doing, who's involved, how we're moving forward. And they've expressed, interest in, sort of working alongside of us, making introductions already today. We had some introductions about the tech forum coming up, and be able to sort of just demonstrate and discuss more of this. We'll talk about that over the next week or so. But it's a great partnership, and it's a particularly good one when we're talking to foundations for support and other state and local organizations. If you can really represent a collaborative, truly a collaborative spirit, which is the whole purpose of the NIC, which was the vision of it 4 years ago, was to get to this point, to be able to bring together the national, a national view of some of these problems. And here's a problem, and here's a team that can maybe make some progress on it in the near term. So, that's it. That's the discussion we had there. Let me just, before we pivot to the next topic, any comments? I'm going to open up the floor. Any comments or questions? And if not, I'm going to ask people to speak. So.
What's the next step, Daniel, in terms of moving this forward?
Yeah, so thanks, Matt. So the next step is for us to articulate this in ways that can be consumed by and sort of disseminated with and through ONC, I would say. They're going to have some conversations internally on how to interact with this group, and in ways to actually do it within, federal agencies have, a lot of restrictions in what they can do and how they can behave, which is good. And also, just we have to be mindful of where and what they can do. But so there's a serious conversation happening. And as I said, there are some forums that are coming up. We've agreed to, they've, suggested some introductions to, there's a SDOH working group at the federal level. One of the things I didn't mention on the PowerPoint is this idea of a federal coordinating council, because I think ultimately for this work to really get done, like any state or any county, people only have a certain amount of authority in their silos. And so to cross those silos, you need a higher entity. So we're trying to push up to say, this really touches, not only ACF and CMS and FNS and CMI, but also, CDC is involved with stuff like this, and HRSA is involved with this, and then HUD is involved. And if there is some orchestration of that, and I know it takes a new administration a while to, to get, really in the rhythm of it. But what I shared was when we worked for the first Obama administration, that actually started to happen, and it was an incredibly powerful one. And that may already be happening. I don't want to suppose that it's not. There are probably lots of working groups that are happening and thinking about that. It's not a new idea. So the idea is to try to move it from a federal level, especially on some of the, some of the legal aspects. Can we create a safe zone basically to go do this work and indemnify folks who want to take the first step in a way? So it's open. The channels are open. The conversations available to be had.
My question for you, Daniel, and I'm sorry to be so pedantic, but where are we in the agenda? Since I'm not sure that we've talked about news or working group status, I thought that what you were going to talk about, we would be doing as part of the feature stuff.
Yep, that's what we're.
I'm just lost. That's all.
Okay, Brian. Well, we'll help you be found. So we're gonna actually pivot now to essentially the consent working groups. So I felt
Before we do that, Daniel, though, we do have one working group status.
Oh, great.
We need to yield at least to Eric to tell us what's going on with the architecture working group.
That's
Eric,
right.
are you there?
Yes, I am here, and I've been waiting with bated breath for someone to interrupt. Thank you. No, I'm just kidding. I missed the meeting, so thank you, Daniel, for the summary. So two working groups I'm working with. One is the ontology working group. They're having a meeting on the 20th or the 27th. We're having a dual poll right now. If you sign up with Amanda to express your interest in joining the ontology group, any human services ontology is fair game for the group. We're inventorying and working on filling gaps between ontologies. And just tell Amanda you want to join the group. But anyway, we have a doodle poll out to all the current membership. The 20th or the 27th will be our next meeting. We have them every other month. And I believe Robin York will be presenting on her child welfare ontology work with Protege. And then we've got some others new to the group who will be presenting on some mapping tools for ontologies that they've been working on. And I'll give an update on my HUD ontology I'm working on for homeless management information systems for doing under contract with HUD technical assistance that I should be wrapping up in some weeks. So we've got some things and anything else. If you have agenda items, just join the group, and the agenda will be on the invite that you get out. I have to add the link to the agenda for everyone who's already got the invite. And yeah, we'll see you either in the 20th or the 27th, whichever one wins the poll. And then to pivot to the architecture work group, that one hasn't kicked off yet. And we're kind of framing it. I'm in discussions with Brian and others about, what's this group supposed to do? I'm really thinking as a model, something like the Open Health Information Exchange is a good way of looking at it, where they don't pin it to specific, like open source projects. They set up a series of requirements, behaviors that are needed of an open, in this case, human services information exchange, or CIE of some sort, and what implementations are out there as reference implementations for each functionality. So if you want to join that group, just tell Amanda and we'll get you on. We haven't had our kickoff meeting yet, like we had for ontologies. We had our kickoff for that in June. But I'm thinking those will probably be monthly, just because there's a lot of work to do and we can't work as independently on that as we can with the ontologies. So I'll stop there. Any questions or comments about either of the two work group meetings coming up?
No, thank you, Eric and Daniel. I feel like I've done my pedantic duty, and I return the talking stick back to you.
Thank you, Brian.
Thanks, Brian. Yeah, and so there's some information again on the hub about these different working groups. So If you look there, or just, and again, on the hub, you can find everybody's contact information, or on the meeting invite, you should be able to get it as well. So feel free to reach out to folks and express interest, or set up a conversation if you want to do that.
So Daniel, this is Dave. Is
Hey, Dave.
person matching still on your radar screen?
As soon as you're ready, Dave, we're ready to present it. I know that you said you were preparing some of that a couple weeks ago. So you thought I thought it was kind of late August that you would be ready to talk about that. Is that
Oh,
correct?
they gave a presentation last week. You may have missed it. Was it last week, Dave, that you and Sarah gave a
right.
I think it was actually the week
before last.
Yeah, the week before that, Brian, I think. So
I think
anyhow,
you may have been on vacation, Daniel.
Yeah, I was on vacation. That's right. I was up in the rainy woods of Vermont.
But
So-
the answer to your question, Dave, is absolutely it's on our radar. It's
Okay.
part of our constellation here, and a critical part of it.
So
Did you feel like you needed to talk about new status associated with it?
Well, there's a group of people that were previously associated with the TAC that are actually working on the proof of concept implementation. And where we're at with right now is feeding data into that. So out of fire resources to begin with, take the information out of, well, it starts with Cynthia, the synthetic data generator, and putting that into fire repositories, and then from fire repositories into the person matching processes. And where we had gotten to was implementations in the Google Cloud and the Amazon Cloud and on a private cloud. So we're taking that to the next level. I'll be reaching out to you all in maybe a week, maybe two, for another presentation, because I expect significant progress.
Great.
Okay. That's super great. So yeah, Amanda, we're just, everybody with the holiday, with summer vacations and schedules and stuff like that, and all the conferences, we're kind of juggling the, who can do what when. So if you just work with Amanda, we'll over the next 4 or 6 weeks, we'll make sure we come back to it and spend the time on it. Thanks. Brian, anything else?
No, that's it. I think we're ready to go on to the feature topic.
Bada boom. Adam, over to you.
Bada boom. Okay, I'm gonna start my video again. So Amanda, would you please call up the, let's start by calling up the working document. Actually, call up the SharePoint site, because I want to ask a couple questions. And for the new people, orient them just a little bit for a couple minutes, if you could do that. So if for the new folks, and there are a number, sorry we missed Alex for this part of the conversation, but I think we can, Karen, maybe you can brief him. And I'll follow up with you both as well. This is the SharePoint site where we are actively just doing the work. There's only one document there that we really need to focus on, but I just want to give a quick overview. First, let me just ask the group here, because most of the people here have been here for a while. Does this SharePoint site work for you as a means of providing input? And again, I'll get to what that means for the new folks, but would a Google Doc be easier? I just don't want the technology or the MO to get in the way of people participating optimally. Anybody have a problem with using this?
I can chime in from the legal team. I don't think Jennifer's on, but we, when we set up our document, because we had a greater comfort level initially with using Google Docs, we created a spreadsheet on Google Docs, which we can, I was just looking at it before the call. It's probably in a position now where we can share it with you, but I haven't gone back around to see if everybody else on the work group has already made whatever additions they wanted to.
So you have reached out to your work group to get input on what you and Jennifer concocted?
Yeah, everyone in the work group has had access to the Google document. So I probably should just share it with you at this point so that you—
Sure. So let me just say that again, to orient people, so Chris and Jennifer Bernstein are the co-leads we have 3 teams working. One is legal, one is technical, one is best practice, is promising practices. And each of those teams has 2 co-leads. Chris and Jennifer are the co-leads of the legal, and I will ask Brian after Chris finishes to give a 1-2 minutes of where we are on the technical team and input into the document. But Chris, if you would hold off, I'm going to go to the sort of team presentations in a minute, but I want to finish this overview, okay? And then I'll come right back to you. So again, to orient people, there are a few docs I want to point out to you. You don't need to open them, Amanda, but everything that you really need is under live working docs. If you could open that, we will not open all the subfolders. And so if anybody does not have access to SharePoint, just send Amanda a note and she'll give you access. And this is where you will see the information that centers on the consent project on which we are working. And I think you all know at least what that is. There are interview questions, which we have revised the template for those interview questions. Those are experts and people who are in the project, are part of the projects that we are featuring in our scan, highlighting in our scan. I will ask Amanda later, if we have time, to open up the document with a new template we have for those questions. There is there it is, the scan report tracking sheet, which looks at, who are we interviewing, what are the projects, what are the resources that we're looking at, etc. Anyone who hasn't looked, take a look. I think it's self-explanatory, and you can feed into that. And with that said, the one that I want to focus on that we really need to get everybody's participation on, and lots of people are participating, thank you for that, is the, where is it? There it is, working draft. If you could call that up, Amanda. I will speak to that for a minute and then hand it back to Chris. So I'm constantly updating this. I did so most recently today. Please, if you haven't, take a look. You'll get a sense of what's in it, and with some instruction in various colors of ink, so that we don't hopefully confuse content with commentary. What we are asking of everybody is to go in there at your leisure, but sooner rather than later, because we have deadlines. I'm looking at Matt's. Okay, so I will get back to that question of whether we want to keep using SharePoint or whether we want to put this particular document that we want everyone feeding into, whether folks think that it should be a Google Doc for ease of access. I'll get back to that because that's an important question. Yeah, there you go. So I've sort of laid out what the executive summary looks like, and you can scroll down. Each of the 3 teams is providing input into this document. And again, maybe when it becomes a Google Doc, it'll expedite that process. And we invite any of the new folks, every one of the new folks, to please join one of the 3 teams if you have time, inclination, and bandwidth. But whether you do and we would love for you to do that, just let us know which you want to join. Again, technology, legal, and promising practices. But irrespective of whether you join, please take a look at at this document and provide input. If you know something that should be here, we want you and write it as though you're writing into the document, not just bullet points, but feel free to add comments or questions or just, hey, you guys should explore X. That's all fine. We want it, but we do want actively want your participation, and particularly in the next. I've asked all the team leaders whether we could start getting really more robust content. Not that we don't have some, but in the next week or so, and maybe we can revisit this during a work session with the full group, maybe next week or the week after. And with that, Chris, if you want to just give us an update on where you are and what you're up to, I think that'll be instructive for everybody. And by the way, after, so we can make this smooth, Chris, when you're done, if Brian, you could pick the ball up, and then I'm going to ask Pooja to weigh in for a few minutes because she and her group are helping us with this work as well. Chris?
Adam, if you don't mind, I actually have a 5 o'clock.
Then would
do you mind if I can just talk real briefly?
I'd love for you to
Yeah.
go next.
Okay.
Yeah, and Chris, we're postponing
That's
you.
good by me. That's fine.
Sorry. I
No,
probably
thank
should
you
have
for
warned
speaking
you.
up. That's great.
If I can actually share my screen so I can just show.
Great.
Let me make sure I'm pulling up the right document. All right, can you guys see this outline? Probably it's small, I'm on my laptop. Okay, so what we're doing at Point of Care Partners, as I mentioned, we had done some work with MyHIN looking at e-consent when it's associated just basically in healthcare and what that means. And so this was just a quick outline. Another colleague of mine, Michael Solomon, and I had worked on that project. So we're planning on providing content just around healthcare specifically, and talking about, informed consent, which is really kind of the push in healthcare today. We're all used to folks bringing a tablet to the bedside and, going through and quickly signing things. But, really the push now is to make sure that whatever the patient is signing, they really understand. And so providing a little bit of background on that. There is a lot of work being done. We talked a little bit about ONC. I know a lot of the HIEs are doing work. There's FHIR resources out there. Even at NCPDP on the pharmacy side, there's consent work being done on sharing consent around specialty medications, because it takes so long, just to get your specialty medication. So we'll be talking about some of that current state, and also just future directions of what's happening. And then what Michael and I had done around the project is, we actually dug into kind of the success factors around e-consent in healthcare. And we came across, I think there were 5 different studies that we looked at. And our goal is to do a little bit of a deeper dive with those, but bring out the lessons of, kind of best practices and things. And so, Adam, I know you were asking about being able to put some of this content in. I just spoke to Michael, and our goal is to, over the next week or so, just flesh out, this outline and start adding everything into the document. So that's our target around that.
Great. Pooja, thank you so much. This is a big contribution on your part. We appreciate it.
Absolutely.
Chris, I think you're actually going to get to talk.
Okay, cool. Let me share my screen. Yeah. I can't be on video because I have a really lousy connection and it's making everyone sound like robots. So can you see the screen, my screen?
Yep.
Cool. All right. So this is, I've tried to shrink it down so you can see it a little better. The credit, I mean, my other colleagues on this committee may have also made contributions, but from looking at it, it looks like almost all of it has come from Jennifer. So she really gets serious kudos for this. Over here is the domain, of basically this is our chart of all where the laws are now. It's our scan. So you know, here's the domain education, for example, and then we've got all the different possible breakdowns with where the law, where there might be an area of law, and then the law itself. This is what I'm indicating with swirling around. And if you look over to the side, this is where we've got all the resources actually listed. And this is how I know Jennifer did most of it, because they're all networked for public health law resources. She yellowed out. I was on vacation last week and she's at the HIMSS conference now. So we actually haven't spoken since in a week. But the yellowed areas are the ones that I'm actually going into right now and filling in what I know about those areas. We honestly, so this is, these two columns here are, you know, federal law and federal regulations. That not so sure if in this first pass we'll have any particularly known good state laws, but that may be something that we may want to put out to the larger group at some point to see if folks know that, oh, Oregon has a really great law on privacy, it's a great model or whatever. But at this blush with this working group, I don't think we're going to get there. The same with like informative procedures and policies or practices that people know about. It just felt like that was getting a little too deep, possibly, for this overall scan. But it certainly would make sense to capture that information if we can figure out a way to get it from the group. Otherwise, maybe that's something that happens at a, you know, a tier 2 part of a project. So there you have it.
Chris, this is Paul. Can I make a quick comment on this? So we're suffering a little bit here because this is two-dimensional and really something that, you know, for you guys who know how to do other things, this needs to be almost like a Rubik's Cube. And so as Chris was mentioning, you know, that there are different state laws and other dimensions that, you know, we would really love it if others could contribute to this and just add in what you know in this format, and then we can take it and maybe actually, you know, craft the Rubik's Cube.
Let's think about that a minute, Paul, because I don't want people to have to go to 2 or 3 places to contribute. So I wonder if we, maybe once we put this in Google Docs, which sounds like a good idea to me, once we do that, maybe we can somehow attach it, put it at the bottom, or but anyway, make it part of a one destination for people so they can provide their input and not have to look for where it's supposed to go.
Totally fine.
Does anyone know if Google Docs has a pivot table function?
As a what?
Pivot tables. That allows you to basically do what Paul is suggesting on Excel, right? You can.
Well, that's a sorting kind of function, but you have to add the data in.
Right, but it can go into the law. If you have a health law, you can go into the pivot table and look at if there's 1 state or 50 states.
Oh, I see what you're saying.
They're all right there under the health law. You can drill federal and then state.
Yeah.
And it's in the same area. So I just don't know Google Sheets very well. My guess is they got to have something like pivot table.
Sure.
But anybody know that?
I'd be shocked if they didn't do something that competes with Microsoft.
Yeah, it's a really useful. Let's take that, man. Let's take that as an action item. Maybe we can explore that a bit more, because that would be a really good way to be able to present it if you're going to include a chart like that. It's all in one place. To your point, Adam.
And just as an FYI, I just shared this Google Doc with editing. I was going to say skills, but access to Daniel, Adam, and Amanda.
Yeah. Okay. Great. Great.
And Karen, who I think has dropped. I don't know if Karen's still on the call. She just offered to fill in California specific law details, because there's a lot of detail. I think I shared with you her document earlier a lot of detail that they're very much focused on California law. So it's a good start there.
So now there was Monday, was it Monday, the deadline for the first draft? And where did things stand with that so that I have a timeline of working on it more and giving it to you? Well, I've already given it to you, but working on it more.
It's really ongoing, Chris. I mean, whatever you guys can contribute. Two things. First, whatever you can contribute in the time you have is invaluable. So please, we'd like to get stuff in there and well populated within a week so we can really start writing this and have most of the content, but it can always be added, more can always be added later. So this will be an ongoing process.
All right then.
But that's not
that?
that's not like
We're done.
any old time.
Got it.
Thank you.
I think perhaps another question is, when do we want to, what's the end date? When do we need to try to get at least the draft content done so we can move to, first good edit. And I suspect that's going to be, I don't know, Adam, if we've got that at the end of the month.
Yeah, roughly the end of the month.
Yeah.
Okay. Not even so roughly.
Okay, I'll stop sharing now.
Thank you. That's great. And Chris, just to clarify, and you will take that content and turn it into prose in the main document too, yes?
That's what they pay us to do as lawyers, yes.
Well, if someone's paying you, would you let me in on that deal?
Dude,
Okay,
you
that's
picked
great.
the wrong writing career.
Yeah. Brian, do you want a very quick update? I'm being mindful of the clock on what's happening in technology.
Very quick, I'll keep it under 60 seconds. I'd already dropped into the document a list of technical consent services and app descriptions based on what Eric and I had learned about the San Diego CDS LEAP architecture and the consent to share architecture. And we sliced and diced and kind of laid out all of the different possible little things, services and apps that each of these systems really require to be implemented. And today I've regrouped the things that were left that Adam and others had originally created in there under a section on standards that I now need to document. Standards for authentication and cybersecurity or identity management, or open source solutions, or what's going on in HL7, et cetera, et cetera, et cetera. And I will reorganize that and get something written up in the next couple of days.
Great. And so a unadvertised guest, Sid, would you mind giving us 2 minutes on what you provided? The content you provided was a very good example, I think, of why expertise outside of our own little steward's world is so important. Could you just briefly explain to folks what you contributed with your input?
Okay, very briefly, it was looking at some of the consequences of consent, particularly in the child welfare and substance use area, noting that there are barriers at the client level and at the agency level and legal as well when consent is shared either by the client or once the client is consented by agencies sharing information about potentially illegal behavior or behavior that courts or caseworkers can construe as a problem for child risk and safety. I also noted that there are some other barriers resulting from a lot of national publicity about recent invasions of information systems that were supposedly secure. So I pointed those out as cautions, particularly applying in child welfare and substance use.
That's great. That was valuable. Thank you. So I think we're going to make the executive decision that we're going to, that we meaning Amanda, are going to make, create a Google Doc and move the working document to Google Docs. And we will send everyone working on the project an email giving them a link to that document. And again, you get a sense of what's coming, and you all have terrific expertise that certainly I don't have. I'm doing the main writing, but I don't know what you guys know. So what the information you provide is invaluable to this document, and we're very, very grateful for your input, and do request that you provide it. In the next week or two would be really great. And with that,
yeah,
Dan?
that's great. No, that's terrific. It's really exciting to see the work happening. There's a couple of as this momentum grows, and we think about how to make sure we're representing the various perspectives on this. I know that we also want to make sure we get education and justice and probation represented here. And so there's some folks here that probably need to have conversations with around making sure we get those voices into it, because if we've got health and children's services and housing and all those things, let's see if we can get a more comprehensive view of that, so it's represented in the documentation, at least for the first blush of it. So that's what we got. I just got, as we were speaking here, just one follow-up note. I got an email from hang on one second. Allison Kemp, I don't think she's on the call here now. I don't know if she's at ONC. She works with Sam Mackler and Joanna Henry and Anastasia and Ryan about this tech forum in September. So it's sounds like a virtual conference, and there's a sort of a virtual showcase there, and they've offered us to be there for the day, as I understand it right now. So we just have to commit to having people there to be able to represent and talk. So as I learn more about what that means, we'll make that we'll talk about that next week in terms of who would want to participate in that, and what that commitment might look like, and what we'd want to prepare to have ready for folks if we're going to concentrate on this work and kind of unifying consent, what that might look like. I think that would be just a great opportunity, because I know the last ONC meeting I was at, there were 1,000 people on the call or something like that, or a whole bunch of folks there. So it's a great opportunity to sort of spread the dissemination of the ideas. And by then, in September, we should have we'll be a month farther along on this work, so it should be pretty exciting. And if anybody has either experience with that or knowledge or interest, wave your hand, send an email, or we'll raise that as a topic of conversation next week. See who wants to participate. So with that, I think we've come to the end of our agenda here. If anyone has comments, thoughts, questions they want to offer up at the moment, the floor is open.
And in particular, if anybody has any questions or comments about this working document that we've set up, please, let's hear it.
So Daniel, this is Dave. Question for you. I think the document is great. I think the work that's being done is super. My question is, do you intend to try and take this to a proof of concept, or are you going to stop at a document?
No, we're actively, the idea of the consent scan is to gather and understand what the promising practices are, what we can build from, and then depending on funding availability and how it syncs up with the ongoing work in the Inc. sites and others, absolutely would want to look at building out that proof of concept to support that work. I know that the work in New York and in New Jersey in particular are really dependent in many ways on the consent in order to get at the data that is needed. So, the answer is, definitely maybe, We're certainly hoping to get to there, and we have the right information and the resources to do that. We're working on along that front as well to secure the resources to be able to build that out. And if you remember, Dave, we had talked about you guys with May, June, and folks taking the assessment, the mobile assessment form or proof of concept, and actually we're pivoting that to what a consent might look like. That was, I know there's different examples of it out there. I know some of the now pals and folks have a pretty elegant, sort of user interface, and I'm sure others do as well. But how do we represent that in a, multiple languages and accessible multiple languages, so people really have a informed and a knowledgeable sense of what they're consenting to.
Super, thank you.
Yep. Cool. Other thoughts, questions? All right, then we will be gathering again next week. So I'm sure we'll be talking to you as we go forward. So thanks, everyone. Have a great, wonderful day. Rest of the day, at least for that matter.
Yeah.
Nice to
Thanks,
see you all.
everybody.
Happy summer all.
Bye.